Thank you very much, Bwana Sisi. Please be seated. Sisi, wewe unakumbuka ile mambo ya Nyayo? When people walikuwa napiga makofi 1, 2, 3. We have since moved a bit, so now we do milpolo. You know, just one big clap. I'm really privileged and honored on behalf of the people of Homabay to host this very distinguished gathering. Before I say a few things, I'd like to invite Charlene to just say a word, your commitment as the youth champion. You have spoken here, you've spoken very strongly. And I've not really heard you speak, but I'm very impressed by the character of your thought. I think you're going very far in championing. Please come. Yeah. Just a minute.
Okay. Thank you, Excellency. I wasn't expecting for her to call me here, but thank you so much, and thank you for giving us space for the young people on the table, and to Dr. Masha as well, and Dr. Medin from UNAIDS. As young people, what I want to commit on behalf of the young people is that we are going to raise awareness, we are going to advocate, we are going to receive information and disseminate it fully to our fellow young people so that we are the ones on the ground who are championing against the triple threat. I think that's it. Yeah, that is it. Short and sweet like honey.
Asante sana. I think that's very well put, very precise, and achievable for the young people. So thank you, Charlene, and thank you for making time to come out to Homabay. Dr. Masha, you're an honorary Homabayan. We're always happy to have you. Dr. Medin, thank you so much. You're coming back to Homabay. Last year we were together, Dr. Shaheen. We are very happy to have you, Ms. Demanche from IOM, all our partners, Dr. Tiso, who's my former boss. She hired me at LVCT Health. I used to work for her. And when I was coming to be governor here, it just happened coincidentally that LVCT was the lead implementing partner for our CDC programs, and that was a very good coincidence. So I welcome you once again to the Bay of Endless Potential. We had made a commitment to finish by 4 o'clock. Mr. Speaker, sir, and the entire assembly, asante sana. Your assembly is always ready to put together our policy frameworks around these issues. And for that, we thank you. And I am happy that the leadership of the assembly is here to support this cause. I see also our executive committee members. Roslyn has spoken. Roslyn is our CC for health. Asante sana, she's the one who's been leading this process. Thank you. CC for governance, Grace Masi Osewe. I don't know if there's any other member of the county executive, please. Yeah, the county CC for roads, Danish. When the men were told to stand, they were standing forcefully. We are here. CC for education, Mr. Pere. Our chief officers, please just rise. Chief Officer for Health, Dr. Suri. Chief Officer for Livestock, Bernardo Mwanda. Chief Officer for Communication, Atieno Tieno. The rest of the staff of Homabay, just wave. Thank you for hosting this wonderful session. And I once again welcome you to this Bay of Endless Potential. I know we are to finish by 4 o'clock, so it is our intention to finish in not so far from 4 o'clock. Had I gotten the mic before 4 o'clock, we probably would have tried to finish by 4. But I hope that maybe 4:30 or thereabout, it would still be good time to drive back to Kisumu. And one of the commitments we are making is that in the very near future, while we have flights landing in Homabay, they are not daily, but in the very near future, we commit that you will not have to endure the drive from Kisumu coming into Homabay. We are working towards daily flights landing in Homabay, so that when you're coming to Homabay, it's not a project that you have to plan until you do monitoring and evaluation. You just wake up and come to Homabay and go back to, you come to Wilson, come to Homabay, go back to Nairobi through Wilson. So that is something that we are working on. And I also welcome you to this bay of endless potential. If you've ever wondered why Homabay, those there are the Homa Hills. And this here is the bay. So that is Homa Bay. That is how this comes about. And I welcome you to come back to holiday as well. We have the Ruma National Park. It has rhinos, buffaloes, giraffe. It's 25 minutes out of here, and you can see 3 of the big 5. And if you move out, those who went to Tomboya, you saw that it's one of the most beautiful places. And you didn't even go, further on to Mpangano and Takawiri. We have white sand beaches in Homabay. So for our guests, really consider Homabay the next time you're around. We went to Ndiwa, and I think it was very eye-opening. And many times you assume many things, and you think you know things. Like for us who are always on the ground, you think you understand the issues, and sometimes you don't. Yeah, many times you don't. Why? Because Masha talked about privilege also. To a large extent, sometimes you don't see it from the lens. And these girls, told us their stories. And they said, look, me, I was in class 8, we went for sports, and I had nothing, and our home had nothing. And so my friend, told me she had some money, and I asked her, how do you have money? And she said, I have a boyfriend who gave me, and they went, and she had other boys on the line whom she introduced. And she was the one who kept on saying, when this girl said, I have to go home, she said, no, just talk to the boy, because she was bought juice for 30 bob. And the story was the same, all around the room. And it was a one-nighter, and they got pregnant, and they're having children, and that was the end, to a large extent, of some of their education. So the poverty story, for me, stuck. And our role in poverty alleviation, and we might not do everything. We might not eradicate poverty, as is the story, not in our generation maybe, but if we do small things that lead families to have some income so that they can take care of their children, small needs. Mama, I'm going for sports, could I have 100 bob? Small needs like those. And Charlene was talking about lotions and what have you, just small needs. And so for me, in my heart, I made a commitment that as governor of Homabay, I'm going to work double hard to ensure that the people of Homabay have money in their pockets, because that might save one girl or 2 or 3 or 4 or 5, whatever, who might have fallen into the trap. Then there was just the lack of information. We do our mentorship, we do it in high school. You're talking to 16-year-olds, 15-year-olds. These girls were 12, maybe they're in primary schools. The information must get out much earlier than we are doing. Because once the trap is earlier and they know nothing, absolutely, about the things they're being told about. And the peer pressure element. So there's a lot that we learned today. But nonetheless, we have our hands full this time, because when HIV came, the battles were fought. But besides combating HIV, right now our communities are facing other equally devastating epidemics that threaten to do worse. The triple threat of new HIV infections, teenage pregnancies, and sexual and gender-based violence, for which we are here today. Our job is cut out, with numbers showing much more to be done as we race towards the set deadlines. In September last year, Homabay played host to CS Susan Akumisha, together with CS Rebecca Miano, and I think Dr. Shaheen, Dr. Medin, I think even Dr. Masha. We were all here as we launched a rapid results initiative towards the Kenya plan to end AIDS in children by 2027. By joining forces, we pledged to make a significant impact by implementing various strategies to prevent HIV transmission among children. Under the theme, Wakati ni Sasa, End AIDS in Children, we affirmed our full commitment to this mission of safeguarding our children and ending the AIDS epidemic. This meeting thus should be one of the platforms for us to review our progress and to ascertain how much more ground we need to cover to achieve these pledges, both as leaders and as governments. With over 120,600 people in Homabay living with HIV, a prevalence of 15.2%, 1,240 new infections in the year 2023, and a mother-to-child infections rate at 5.3% against the Global Alliance target of below 5%, I graciously took the role of a lead ambassador for elimination of vertical transmission of HIV, as well as an ambassador for the triple threat, and I have not shied away from participating in the conversation to sustain the gains made in this near epidemic control for HIV in Homabay County, even amidst the CDC-laid roadmap for self-reliance and transition of HIV response. Working with partners, especially UNICEF, we have moved in to address data discrepancies, inaccuracy, inconsistency, and incompleteness generated in the current data management system, as well as systemic issues affecting the quality of prevention and elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B reported from health facilities in the county. The quality PMTCT data that can be used for decision-making at all levels in the country, and the impact of change on the triple elimination of vertical transmission of HIV, syphilis, hepatitis B in Kenya would mean improved accuracy in PMTCT data, enhanced monitoring and evaluation of PMTCT program, informed decision-making for PMTCT interventions, optimized resource allocation for PMTCT, identification of gaps in PMTCT data reporting, increased accountability in PMTCT programs, and enhanced community engagement in PMTCT. Teenage pregnancy is another area of great concern, not only to me, but to all of us as leaders. I had recently the president also saying that Kenya was also among the highest teenage pregnancies in the continent and in the world. Now that is very disturbing. It's extremely disturbing. With those with whom we were at Ndiwa, as I said in the morning before we left, every time you step into a facility within this county, you are 100% sure. The probability, if I remember my maths, the probability that you will get an adolescent who has delivered or is pregnant, the probability is 1. You are for sure certain you will get an adolescent between 10 and 19 years who is delivering at that facility. This is an epidemic. This is a serious matter. We are losing a generation. We are losing an entire generation of girls, and I don't know who is going to stand up after us to speak on some of these issues. Who are going to be the leaders? And we are treating it as if it's normal. And I think we must stop treating it as normal. And when somebody said, when we listened to the lack of information and just ignorance on these matters, a campaign to the magnitude of what we did to reverse HIV in this country is required on this issue of adolescent pregnancies so that we can avoid losing an entire generation. At a prevalence of 23%, 23%, you know? And when we were in Diwa, we were told 75% nearly of CSs there are adolescents. Homabay ranks 6th, an indicator that we must reverse. Adolescent pregnancies pose not only health risks to young girls, but it is both psychological and physiological burden in the communities. A higher risk of low birth weight babies, preterm babies, severe neonatal conditions like respiratory distress syndrome, and others. To combat teenage pregnancy, part of our program has been to organize both girls and boys mentorship camps as platform through which teenagers can be mentored and challenged to prioritize constructive decisions over what has the potential of cutting their career dreams short. This month, earlier this year in March, we held a boys mentorship camp. This month, we have a plan to hold a girls' mentorship camp, something I have done since 2014. We used to call it Mama County Says, and now we call it the Governor's Mentorship Camp. And I would like to invite all our partners who are here to please partner with us in supporting this Governor's Mentorship Camp as an opportunity, as one of the small ways through which we can pass correct information to our people. So we'll be hosting this mentorship camp at Ratanga Girls in Diwa, and we are writing to I think we have written and we continue to write to our partners to seek support for this mentorship camp. And I thank our partners because they have worked with us this mentorship journey consistently over the years. Additionally, we have heightened advocacy and communication in the wards in the wards that have high rate of teenage pregnancies, and had a training of youth champions who are championing adolescent sexual and reproductive health in the community and other forums. Reduction of teenage pregnancy from 32, this resulted in reduction of teenage pregnancy from 33 to 23%. We are also working closely with our community health promoters. You saw them in Tomboya, you saw them in Diwa, to pass these messages as candidly as possible within the communities. Last year, March, as part of our celebrations of the International Women's Day, we launched our county's sexual and gender-based violence policy framework, marking a crucial step in addressing this issue in our county. Since then, we have held community dialogues with stakeholders at grassroots, reaching over 3,000 people, while at the same time disseminating abridged copies and customized messaging to over 4,000 stakeholders across the county. Moreover, we have established safe spaces and rescue and hope centers for SGBV survivors at Makongeni, Mbita, Rangwe, and the County Referral Hospital. And this is in partnership with several of our partners whom we thank immensely for their support. We are also working closely with the National Security Services, and thank you, our County Commissioner, for your partnership with us, and the justice system to apprehend the perpetrators and seek justice for survivors. I think we already had the Ndiwa story. In conclusion, it is my plea that this high-level experiential learning visit to Homabay will help us come up with unbeatable ideas on how we can achieve our targets and make this society and that of future generations safe, secure, and free of HIV and AIDS, early pregnancies, and cases of violence of whichever form. I'd like to ask our partners, wherever you are, to look out for Homabay. Whatever programs that are there, we'd like to urge you to always be our ambassadors, remember us, and remember Homabay, and to thank immensely all our partners who have made this possible and the organizing committee. And with this, I say, may God bless Homabay, may God bless Kenya as we work together towards ending the triple threat. Asanteni sana, and God bless you.